Hi, Mike Gibson, Mike Reardon, coming to you live from ACC 2025, and we're talking about the 5-year outcomes of TAVR versus surgical aortic valve replacement in low-risk patients. Mike, what did you see?
Well, thank you, Mike. It's very interesting. Remember I presented the 4-year data at TCT last year. And the one thing I pointed out is that we all know TAVR has an early advantage in survival, stroke, and recovery, and that at 4 years, the primary endpoint was still widening out in favor of TAVR to a 0.05 level. Now what we see is that it started to come back together between year 4 and 5. It's still numerically better for TAVR, still non-inferior, but it's come back together. So the thing I asked myself is, why is it coming back together? So I took the primary endpoint and divided it into stroke, disabling stroke, and all-cause mortality. Disabling stroke has not changed, but all-cause mortality has started to come back together. So I took all-cause mortality and divided it into non-cardiovascular and cardiovascular. And what we see is that the non-cardiovascular, which we would expect to be pretty even between the groups in a randomized trial, wobbled in favor of TAVR between year 3 and 4 and wobbled back in favor of surgery year 4 and 5. In fact, when I looked at the reasons of death, in TAVR arm, there was 7 malignant deaths, surgery there was 1. 3
Mm.
COVID deaths, surgery 2. 3 sepsis deaths, surgery 0. 3 respiratory deaths in TAVR, 1 in surgery. So clearly wasn't random. But these things, small groups, are going to wobble back and forth. Then
Yeah.
I went to cardiovascular mortality, which should have some effect on the valve and how we treat the disease. And it is still widening. The delta at 2 years, the primary endpoint was 1.1, it's now 2.1. So seeing that cardiovascular mortality is still widening in favor of TAVR gives me faith that in this low risk population, TAVR with Evolut still is a good option at 5 years for patients versus surgery. So that's kind of the trial in a nutshell.
Yeah. Mike, how many years are you going to follow these folks up to?
10 years according to protocol. I'm pushing very hard that we follow them forever. As you know, Michael, they've had a real move to younger, lower risk patients. And one thing that I've pushed Medtronic is in this low risk trial, we should give our data transparently to the medical field every single year because these are young patients. So we presented data every single year, and I'm going to continue to push for that because I think that's important for people to know.
I agree. And here at BAME, I built a registry where we can follow people out indefinitely. So at the time of randomization, we're going to check in on people once a year by text, email, their family member, etc., for as long as we can, because these are permanently implantable devices. We got to know what's going on. So,
We fully agree with you. A couple
yeah,
other interesting things about the trial. We there was almost no PVL in the TAVR arm above mild. It was about 86% none trace, 14% mild. Then we looked at the difference in mortality at 5 years between those that had mild at 31 days and then had none trace. No difference, which is,
really.
yeah,
Huh.
no difference at all.
I
We
was
also looked
surprised by that. Are you surprised, Mike?
a little bit surprised by that. I mean, maybe when we follow it out further, it'll change. The only difference is the clinical outcomes were no fib and surgery. Now, the other thing that was interesting, there's no difference in the reintervention rates between TAVR arm and surgical arm. And then of the people that got reinterventions, there were 3 that were done by transcatheter and TAVR arm and 3 done by transcatheter and surgical. All the rest were surgery. And of those, there was 2 deaths in each group for 11% in TAVR, 18% in surgery. We're all talking about the risk of TAVR explant and surgery, but these are all retrospective trials comparing different groups. Now, in a randomized group, high risk in both, no difference, and no difference in the rate of reintervention. So again, something that makes me feel comfortable at 5 years. But as you said, we want to follow this as long as possible.
Absolutely. Well, so thankful for your efforts to get that long-term follow-up. We all appreciate our patients appreciate it. Keep up the great work. We look forward to your yearly updates. Very important stuff. Let's not get confused by the wobbles. Uh,
Yeah.
let's watch that cardiovascular mortality. Thanks, Mike. Thanks for joining us. Thanks to everybody for joining us here live from ACC 2025.